I'm Dr. Vishal Sharma, founder and managing director, Oriheal Lifesciences and Pets Planet India Pet Hospitals. I started Pets Planet India Pet Hospitals in 2001, and as I was a practicing veterinarian, so during my practice, I found a great need of some safe and effective medicines for some chronic diseases like chronic kidney failure, hepatitis, liver cirrhosis, atopic skin disorders, and tick fever, and many other ailments. So at that time, these kind of medicines were not available. So I researched a lot and studied the available study material, and I took the help of experts, and we developed some formulations for pets, and by that the Oriheal Lifesciences came into existence. Now I proudly tell you that we have hundreds plus pet products and medicines as our range. At Oriheal Lifesciences, our priority is our patients and our profession. Our mission is to develop most affordable and most innovative pet medicines and pet products, and we want to add value to our Indian veterinary industry. Our goal is to become a global healthcare organization, and we want to bring Indian veterinary industry at par with international standards. Thank you for being a part of this incredible journey. Thank you.
Before I start, meaningful thank you to Oriheal Lifesciences for providing this wonderful platform for learning, for us all to learn together. Like I said, every time I do one of these education programs, I learn myself, and it's a great learning experience for me. This would not have been possible without the support of the Indian Veterinary Association and the Awadh Pet Practitioners Association. And most of all, a very big thank you to all of you who have come here on a Sunday afternoon to attend this lecture. I hope all of you have managed a small cat nap before you came so that you can pay attention. Today is a light lecture. Last time we started with a little introduction to the subject of our course, which is the feline patient or the cat. And today we're going to move on to something a little more clinical. Your cat is in the clinic, it's in your hands, your clinical examination, life stages of the feline patient, and the care thereof, preventive medication, everything you need to know and talk to the owner about. And finally, ending with just a few photographs of basic techniques, which I'm sure most of you are doing. If you're not, or you have any questions, you will feel free to please ask at that time. Okay, so I'm going to move ahead. My name is Amrita Deb. Thank you for the wonderful introduction, Dr. Sharma. And today is Feeling Fine, or the Cat in the Clinic, which is the clinical examination and preventive healthcare of the feline patient. So the clinical examination, Leonardo da Vinci apparently said the smallest feline is a masterpiece. And all of us who know cats or have cats at home cannot help but agree with this. It's 100% true. They're mysterious marvels. Everything is unique about them, from their behavior to their biochemistry. And today we learn a little more about this species. When we talk about the cat clinical exam across the world, it is recommended that we see a cat in the clinic at least once a year. And here we are talking about well cats. We are talking about a wellness exam, that in addition to all the times that the cat has been sick, there must be an annual visit, even if it is not for a vaccination, once a year while the cat is below 7 years old. And once the cat is above 7 years, twice a year if possible, just to monitor, to do well checks, and to talk to the pet parents or the owners about preventive healthcare. Retrovirus testing status is mandatory for all cats in many countries. So there are two retroviruses in cats. Retroviruses are like human AIDS. They are viruses which sort of hide from the body's immune system, so they can cause long-term effects. We will study them in details when we talk about infectious diseases in our next module. But for now, they are FIV, which is feline immunodeficiency virus, and FELV, which is the feline leukemia virus. And there is one test which actually gives you a information about exposure/infection of these two viruses. It's a snap test. And usually when a cat for the first time it comes into a clinic in most countries, this is done because it will determine your care. These are contagious viruses. These are infectious diseases that they cause. So it is important to know the status. Of course, it is not mandatory to do this in India. It is also important to remember that every test that you add onto a patient costs money. And therefore, this is something that can be offered, but should not be insisted upon. And like I said, we will talk about it in more detail. So FIV and FELV are two words that should be remembered. You want to know a little bit about the common breeds that you see and the signalment. For example, Persian and Persian mixes are predisposed to chronic kidney disease or polycystic kidney disease as well. And this should be kept in mind. They can suffer from polycystic kidneys and develop very early CKD by the time they're 3 or 4 years old. And especially when you're doing anesthesia in these cats, it is important to keep this in mind and to inform the owner as well. Life stage examinations, we talked about this. For some reason, they found that cat owners are 2.3 times less likely than dog owners to bring their cats into the clinic for well checks. Okay, a large part of this has to do with a whole topic that was our last time's module, or we covered a large part of it, which is stress. Cats undergo stress in the clinic. It's a very stressful experience for them and therefore for the owners. So it's important when we are talking about preventive healthcare that we follow some of those feline friendly practices that we talked about last time. We're going to talk about neutering in cats as well, vaccinations, neutering, deworming, everything that forms part of preventive healthcare. And then we're going to talk a little bit about basic techniques that we use in cats. What are the common techniques? What do we do and how do we do it? So moving on. What are the subtle signs of sickness? Of course, if you have a cat who comes in and is recumbent and not eating and barely conscious, it's very clear that this cat is sick. But before that, when we are talking about well cats, when you're talking about a well cat coming into your clinic, it's important for you as a veterinarian to be able to pick up those subtle signs. And I mentioned in the last lecture as well, if any of you were there, that the signs of sickness, pain, and stress in a cat can overlap and be confusing. So it's important for us to pick these things up, whether it's in the history, in the general examination, or later when we run some tests. What are the signs? There's a Healthy Cats for Life website, and this is a very, very informative website. It's also good to direct your clients to it, especially the ones who are interested in Googling. You'd rather them Google the right information than Google wrong information. So you want to look for inappropriate elimination. We talked about this, periuria or littering or littering outside the appropriate or places that they're used to. Changes in social interaction with cats or owners. Changes in activity or sleep patterns. Changes in food or water consumption. I think this is across all species. Any unexpected weight loss or weight gain. 10% is usually our marker that we use for getting worried. Changes in grooming habits or stress. They will overgroom when they have skin diseases or stress. They will or allergies. They will undergroom when they are obese or unwell or have hyperthyroidism. So both of these aspects are important. Both ends of the ranges are important. Vocalization and bad breath. Bad breath is very interesting because sometimes when you open the mouth of a cat, and we will be talking about oral examinations in cats, you do get a lot of gingivitis, we get a lot of oral disease, but sometimes you get a healthy looking mouth with a bad breath. And this is most often noticed under anesthesia. You're opening the mouth to intubate a cat and you notice that this cat has a foul, malodorous mouth. And this can be a very subtle sign of sickness in a cat. It's important to watch for it. So the cat has come into your clinic. It's come in, it said, yes, you want us to see you once a year for a well check. Here we are. A good clinical examination starts with recording history. The history taking, appropriate, targeted, and comprehensive history taking is the first part of a good general examination for any veterinarian, for any patient. So your history involves food or appetite, eating, drinking. We talked about this. Water and drinking, urination and bowel movements, litter tray habits. In a cat, this must not be forgotten. A dog is taken for a walk every day and the owner notices, or the dog walker notices, whereas a cat will hide. You'll only see a clump where the urine is supposed to be. you'll see a clump of litter. So it is important that someone is cleaning that litter tray every day and paying attention to how many clumps are there, how many urine clumps are there, what is the stool looking like, is the timing the regular time, is the consistency regular. Activity, interactions, and grooming, we talked about this. Vaccines and parasite control, we will talk about recommendations later. So keeping up to date whether the compliance of the owners is there. And of course, why has the cat come in today? Is it just for annual vaccinations? Is it because it's sick? What is the presenting complaint? I think perhaps I cannot overemphasize the importance of checking, because like I said, cats have 5 mouths. They have 4 limbs with claws, and they have a mouth that can inflict injury. And this is something we must be careful about, because the safety of our handlers is priority. When we talk about looking at a large number of cats in our clinic, there are certain tools that we would like to have in a drawer next to you or in your examination table. And these are some of them. I've attached a small photograph, and I'm just going to point out what each thing is. We saw this. This is a cat muzzle that we saw in the last lecture. It's very useful to have one of these. It covers the eyes of the cat and lets them breathe through the nose. If you can actually apply it, it's quite useful because it actually calms. I used to be a wild animal veterinarian, and one of the basic tenets of restraint is, if you want to calm an animal, cover the eyes. Take a tea towel and just tie it around the eyes. And it works the same for cats. Any anxious cat, if you can put a muzzle or cover their eyes or let them hide under a towel, it helps a lot. These are little nail clippers that we use for cats. We only cut the tips of the claws. We never cut deep because they can splinter longitudinally. And this can really hurt the cat. So we advise scratchers. We tell them that if they're outdoor cats, they need the claws to protect themselves. They keep sharpening them. This is part of their natural behaviors. So when we're clipping, if we are clipping, we only do the front claws and we only do the tips. This is a vein razor. If you're ever trying to put a cannula in on a Sunday, something like this is great. It's a tourniquet basically, yeah. It's very, very useful. We are going to look at this later. It is a pillow. So it's a pilling gun or a pillow that we use for cats. It's got it looks like a syringe with a flexible disposable tip. I actually don't like the ones where you can change the tip, because sometimes if it gets loose, it can be in the cat's stomach. So these are supposed to be disposable. We do wash them with chlorhexidine and reuse them, because we don't get them easily or they are expensive, but they are very useful things. If the cat owner can buy one and carry it with them, that's even better. This here is the lid and the bottom of a pill crusher. Again, not specific to a cat. This is a pill cutter, magnifying glass, and this is a flea comb, a very, very important part of our examination. So moving on, we are examining the cat. The first part of your clinical examination is examination from a distance. And the second part is examination in hand. So first you examine a cat from the distance, and there's a lot of things you can tell. Firstly, you can tell about the size and age and signalment of the cat. We will go into that in identification later. The second, you can look at the posture of the cat. So what I've got here on the right-hand side is a cat with a happy J. You see the J-shaped tail? This is a happy cat. If you have a quivering, happy, erect tail, this is a curious, happy cat. Okay. If you have a tail that's tucked in, this is a scared cat. We're going to be handling this cat. So when you first look at the cat from a distance, you get a lot of cues as to, look, what are you going to do with this cat? Are you going to handle it in the carrier? Are you going to take it out? You can talk to the owner and say, look, is it going to be more comfortable on your lap? And make the whole examination easier. So this is the first thing you look at, is posture, whether the cat is hissing at you, it's looking scared. You look at head, facial, and pupillary symmetry. So for example, the cat on this left side, you can see that the pupils are uneven. This can be a result of chronic uveitis, for example. One of the first signs of glaucoma, for example, is a dilated pupil. If it can be Horner's syndrome as well, if it is unilateral. If it is sudden onset, it can be an emergency. So it's important to pay attention. It could be it's a neurological sign. It's important to pay attention to the pupils. And of course, you look at the head and facial symmetry. This is an older cat, a senior cat, who has presented with a mandibular swelling, which turned out later to be an osteosarcoma of the mandible. So all of these are things that you can look at the distance. Perhaps the most important thing that should be looked at for every single cat when you do a distance examination or when it's sitting in its carrier is the respiratory rate and character. The minute you have the cat in hand, it's going to be wiggling, it's going to be moving, likely it will get stressed. You will not get a correct respiratory rate and character. So the best time to do this is to actually do it when the cat is at a distance. So you're looking at respiratory rate and character and trauma or skin condition. Can we have everyone on mute, please? That would really help. So this is a little video. Let's hope today's videos play. Yes. And what I want you to pay attention to is actually the respiratory character in this cat. Okay. And I'm going to explain it and play it again, but I just want you to have a look at this. I think it's most obvious actually when the cat initially, as in the first part of the video, but what I want you to pay attention to is that the abdomen seems to expand out when the cat is inspiring. And this is called paradoxical respiration. Just have a look again. And breathing like this should prompt you then, this is just examination from a distance, but breathing like this should then prompt you to examine and then possibly do a radiograph. And the radiograph of this cat shows an incomplete diaphragm. You see the dorsal part of the diaphragm and the ventral part, and in between a diaphragmatic hernia. So a lot that you can tell from examining from a distance. You can also tell neurological status. This is another thing that you can see from a distance, where you can see a distinct head tilt. This is a little kitten that has recently had its ears cleaned at a groomer. This resolved in a few days spontaneously, but you can appreciate the head tilt. I'm really happy about the fact that the videos are playing today, by the way. So, and I do apologize for last time. So that was your examination from the distance. And now we've moved to examination in hand. And you have the cat in hand, and now you know, of course, this is a very nice, sweet little kitten who's very amenable to handling. A lot of times you don't get a lot of opportunity to have the cat in hand. But if and when you do, it's important, for example, to use the mat like we talked about, to calm the cat, to use treats, to sometimes do it in the bottom of the carrier, to do it on your lap or on the client's lap. You can do it on the floor, but be careful. You have to restrain them properly. Otherwise, you'll have a cat running around the clinic who's difficult to catch again. You would want to approach the cat from behind. You want to avoid direct eye contact if possible, at least initially, till the cat trusts you. And you want to use calm, deliberate movements and a voice so that you're not scaring the cat. Okay, because if it gets scared, we remember from the last lecture that the cat's first response is flight over fight. are cats that are being examined. With any species, we like to do a systematic head to tail examination. This is very, very important to make that roadmap that you use every single time consistently. And this is as important in a well cat as in a sick cat, unless it is presented as an emergency where you do not have time to do this and you have to stabilize first. That is possibly the only exception. Or you have an exceptionally fractious cat where you will have to then prioritize what steps you want to use. But say you have this really nice little cat over here and who's allowing you to do everything. You would like to work from head to tail and do a full examination. Again, identification of species. This is a Bengal cat. You can see the lovely leopard stripes and they tend to be bigger. And so knowing your species is, knowing your breeds is an important part of treating any species. We use an examination form, or sometimes your systems will also have it. For example, VetBuddy has an examination form that's inbuilt. That's very easy. You just take okay, and then just write your comments. It just gives you step by step how to go. And this is something that I would recommend when you're first starting out examining, just to make sure you're always systematic and thorough. You'll start always with identification and signalment, like I talked about. Color markings in cats are very, very important things. Okay, so other than the breeds and the signalment that we talked about, so for example, a Maine Coon or a Himalayan is predisposed to hypertrophic cardiomyopathy. Okay, this is something that you should know. When they're 5 or 6 years old, you want to recommend to the owner, look, let's do a test for this, you know. But if you don't know it, then you will not be talking to the owner. And you know it's an occult disease, so it's important at some point to educate yourselves as well. This cat, and this is why I've put the photograph here, is a tricolor. It's white, it's ginger, and it's black or gray. And this is called a calico cat. And calico cats and tortoiseshell cats. So tortoiseshell cats are black and brown without the white. They tend to be largely females. So it's really nice if a cat like this comes in and you look at it in the carrier and say, oh, okay, how is your girl? Or, you know, you have a female cat, what's her name? You know, it's a nice thing for the owners to know that you're familiar with this. So it's not that they cannot be a male, but it's something less than 5% that are males of these color patterns. There are many. There's ginger, there's gray tabbies, there's bicolors. In the system, when you're choosing, you get to choose these colors if you have a software, veterinary software. So it's a good thing to sort of familiarize yourself with the different color markings. Obviously, the pet should have some sort of identification, and we talked about this. So these are either in the form of pet tags. When we're using pet tags in cats, they should be something that is small and doesn't interfere. They don't like big, heavy things around their neck. The collars we mentioned last time should be quick release, so that if they snag somewhere, it should open and not harm the cat, especially if they're indoor-outdoor cats. And of course, there's the unique identification, which is the microchips, which need to be ISO certified. So there's a certain number of digits that it has. We use the 9mm ones. The sort of bore is thinner and they're smaller microchips. Because the syringe, or rather the applicator needle bore is so thick, we like to sedate cats, because you're putting it in, you want to make sure that it stays in, you want to check it after you've put a microchip in. Usually we will put it under the skin on the dorsal neck or shoulder, and we want the cat to be still. If it is struggling and this little thing that is the size of a rice grain falls out, then you wasted the microchip. The cat sometimes bleeds a little bit from the side. Sometimes when you're putting in the applicator, you have to apply a little force. So a little light sedation with a local anesthetic works perfectly. It's not necessary for all cats, but it makes it much, much easier. Okay, so that's a little bit about identification in your pet cats. They say that the nutritional assessment is the 5th vital sign. We talked a lot about nutrition last time, and I did mention a nutritional assessment. Every single time that the cat is examined, the body weight should be taken. And you can encourage the owners as well to monitor body weight at home. It's very simple to either stand with the cat or to put the cat on a scale. The normal pediatric or neonatal scales work very well, or even the human digital scales work well. There is something called the body condition score, which is basically the assessment of body mass. Okay, so it's a physical assessment of the body fat or the body mass. And that score you can either score in a cat from 0 to 9 or from 1 to 5. In a 0 to 9 A 5 is ideal. In a 1 to 5, a 3 is ideal. And this animal has a good fat cover over the ribs. It has a little waist behind the ribs that is appreciable. And so it is what we call the ideal body condition. Nowadays, in addition to this, the Vasava has introduced something called the muscle condition score. So these are the 3 components: the body weight, the body condition score, and the muscle condition score. So why this muscle condition score? Because what they're saying is this is the physical assessment of the muscle mass. And there is, in addition to the normal loss of muscle mass as a feline patient ages, but there is also, due to disease, sometimes the body fat will stay, but there is loss of muscle mass. And so it is important to correlate these 2 things, the body condition score and the muscle mass score. In addition to this, there is something called a fecal scoring system. So Purina has a very nice body condition score chart that we actually give to owners and explain to them when we are talking about if the cat is a little bit overweight. Then it's nice to show them what is ideal, because then they are working towards that over the next 6 months or so. It's just a nice thing to give them a target and tell them what you want their cat to look like and why you're asking them to do this. And similarly, there are scores for muscle condition as well. So muscle condition score is 1 to 3. It's actually really easy. You palpate the muscle over 4 points, which is skull, shoulders. So you're looking at the prominences, right? You're looking at the muscle cover over the prominences, spine, lumbar spine, and pelvis. Okay. And 1 is good and 3 is poor. So this is the opposite of body condition. As body condition becomes fatter, it gets the body condition goes higher. Whereas as the muscle condition gets more severe or there is loss, you get a higher score. I must mention, I said that, so there are chronic diseases like, CKD or a chronic cardiac issue, which may cause a loss of muscle condition in cats. There's also something called an overcoat syndrome in cats. This is basically where the body condition score and the muscle condition score don't match. And I think I have a photograph of one of these. So you can see on the left side, these 2 cats had what we call a little bit obese. So for me, they on a scale of 1 to 5, they would be a 3.5 to 4, definitely a 4. So they are obese. On a scale of 0 to 9, I would put them at a 6.5 maybe, or 7. Okay. So these are very well looked after cats, and they're obviously free fed. So the dry food is left out for them. And the owner thinks that every time they vocalize, they want food, and they're fed a lot. They're young cats, both of them. And the one on the right is something where you can see an overcoat syndrome. Basically, there is still fat. So you're not seeing ribs. You're not seeing ribs, and it's not a thin cat, but the muscles, the bony prominences are prominent. You cannot feel muscle on top of that. And this is overcoat syndrome, when the weight is not less and your body condition score is all okay, but you have a loss in muscle condition. And this happens with chronic diseases. The other thing I must mention is that there are 2 words that you will hear. One is cachexia and one is sarcopenia. Sarcopenia is basically, or sarcopenia. Sarcopenia is basically old age loss of muscle. Okay, and this is okay. Loss of in the absence of cachexia is with disease, and sarcopenia is in the absence of disease. So old age without disease, and cachexia is with disease. So you have the chronic diseases which will cause the loss of body condition. Moving on to our actual general exam. You've done your nutritional assessment, you've done your history taking, you've got your identification on board. This is the correct cat that you're treating and looking at. You've checked if they have a microchip or not. And now you move on to the cat in your hand, where you're looking at the head. When you look at the head, you want to look at the eyes, of course. You want to look at all the structures around the eyes. You want to assess for discharge. You want to look at the anterior chamber, either with a slit lamp or just with a torch from the side. And you maybe want to do a fundic exam. You definitely want to do it in our senior patients, and we are going to talk about it a little bit more in detail. You want to look at the nostrils for any nasal discharge. You want to look for crusting around the nostrils. These are basically the important things. When you look at the gums, why I've put the photograph at the bottom is, number one is this kitten does have very pale gums, but also all you have to do is actually just lift up from the commissure. If you lift up the skin from the commissure or you lift up the lip. This is an easy way to assess gums and teeth in cats. It's also a good start to seeing how the cat likes being handled around the mouth and face. And you show them that, look, you're not hurting them when you're then going to do an oral exam, which I'm going to show you. You're looking at color, you're looking at hydration and CRT, which is similar. You press and you look at how long it takes to refill. And it should be less than 2 seconds in a healthy cat. You also want to look at the oral cavity, and we're going to talk about this, what you're going to look at in the oral cavity in a little bit. And you want to look at the neck, where you look at the mandibular lymph nodes on both sides. A lot of times these are the only lymph nodes which are enlarged in cats. It's very commonly enlarged in cats. It can be due to dental disease. It can be because of upper respiratory infection. And these are some things that you must then check for. The ear canals in cats are a little bit different from dogs. So basically, they are shorter and straighter, and this is important. It's important when we, I've also given you steps on how to clean the ear canals, and I have a short video as well, because we can cause damage if we are not careful. The tympanic membrane is shallower in the ear canal than in dogs. So in the dogs, there's a longer way that the canal goes before you hit the tympanic membrane. And the reason I've put the CT image is because apparently the ventral tympanic bulla in cats has a little septum. Okay, and I think this is where you're looking at the septum. This is the septum of the tympanic bulla, and there is a nerve that runs here. Okay, it's a branch of the sympathetic nervous system. And if that is damaged for any reason, you get Horner syndrome in cats. And this, I think, is the tympanic membrane here, right here. Okay, so shorter ear canals, there's a nerve that goes through, thinner and easily ruptured tympanic membrane. So be careful with the ear cleaning when you're going to do it. How do you do it? You check a cat's ear, but you clean only when necessary. If the cat's ear looks clean, do not take out those forceps and cotton and go. There is no need. It's a self-cleansing mechanism. Leave it be. If gentle ear cleaning, because you can cause Horner syndrome and vestibular damage. So this is important to remember. How we do it? We moisten the ear with the cotton with a ear cleaner. Sometimes you can, in dogs, you pour the ear cleaner into the ear and massage. My experience, this is of course possible if the cat is trained to do this, but if they're not, they hate that feeling of the liquid going in. So what's easier is to moisten the cotton, go in and squeeze it. So you've got a little bit squeeze going into the ear, massage it, and then gently clean out. If you notice any discharge, especially if it's brown and grainy or malodorous, it's important to take a sample for cytology. This is a little video of the ear cleaning. At the end, you will see the amount of discharge that's come out. And if you give them a good experience the first time, they'll let you do more and more the next time. It's like with nail clipping. The first time I only take off tips and I leave it when they're protesting, because then they let me do it much more easily the next time. So as far as my finger reaches, no forceps, no cotton. If I need to get into the folds, which are the part of the outer ear canal, then I will use a not a toothpick, but a Q-tip or a earbud. But I tell the owners never to use a earbud in cats. Okay, they can cause damage. You want to look at the ear pinna as well and the folds. And this is important when we were mentioning mucous membranes. Actually, I find that the first place that you notice jaundice is sometimes in the ear pinna. You're looking at the cat on the table and you notice that there's a yellowish tinge over here. And this is very, very important, sometimes before you even notice on the mucous membranes. The edges of the ear pinna, scabies is possible. Cats get Sarcoptes scabii from dogs. Feline scabies is another species, but we will talk about this in the next lecture. You can also sometimes notice some little crusting lesions, and you must sample this, because cats can get Demodex as well. This is Demodex cati, which is long and slender in cats. And it is rare. If you find it in an adult cat, you must look for something underlying, either a retrovirus, which is bringing down immunity, or some endocrinopathy like diabetes or hyperadrenocorticism. Cat ears are a little bit different from dog ears. Let's discuss the peculiarities. Otitis externa is not so common, only 2 to 6% in cats. It's much, much more common in dogs. The most common cause of otitis in cats is Otodectus cyanotis, which is the ear mite, and they are contagious. So it's very, very important to look for them and treat them. They're also quite easily treatable with either selamectin or with fipronil. I think Advocate works as well, which is moxidectin and imidacloprid. So just every 2 weeks for 3 weeks and retesting if you find it on a cytology of the ear discharge. Bacterial otitis is uncommon, and again, their bacteria are different from the dog bacteria. So usually, so Pseudomonas in cats is very rare. You're going to find rods very rarely. Only then you want to culture it and be more aggressive with the treatment. So usually it is coagulase negative staphylococcus, which is causing a bacterial otitis in cats. So your empirical choices would be either, if you have a severe bacterial otitis, would either be a clavamox or a clindamycin for a cat. Malassezia species is the most common cause of middle ear infections in cats. We see a lot of Malassezia in cats. So it looks like the same brown ceruminous discharge that you see in dogs. And then when you look at it under the microscope, similar footprint shaped yeast is what you're looking at. Mites are possible. We talked about both Demodex and Sarcoptes species. Sarcoptes causes the same itching and pruritus. It's very intense. It's very itchy. It's scabby. It's difficult to find, so it's important to take a good scraping under mineral oil and look at it under 10x. It is possible. And nasopharyngeal polyps are also possible. There are some strange conditions of the cat's ears, but nasopharyngeal polyps are common in cats, not so common in dogs. And these are basically inflammatory polyps that start growing into the ear canal and into the pharyngeal region. And if they grow really big, they can sometimes block and cause chronic rhinitis and sneezing, foul smell to the mouth, some tialism or salivation. So these are important things to look for when you're doing an otoscopic exam in a cat. So this is a little video of a little cat that had ceruminous, that had grainy discharge, and we took a, this is a, someone saying mite party. Sorry about that. One sec, let me just see where my, give me a second. Play from current slide. Okay, and if you haven't, I'm still audible. Yes, can someone confirm with me that I'm still audible and visible? Yes, okay, I'm presuming. Yes. Okay, thank you so much. Thank you. Yes. I appreciate that. And if so, those are the ear mites. They're very, very easy to see. It's very nice to show them to the owners because they're like, wow, you know, I had no idea. So they say that if you go in with an otoscope and look in the ear and you wait for a little while, the light of the otoscope warms up the mites and you can see them crawling. So you don't even need to do a cytology. Number one, those ears are quite dirty. So they're going to really dirty your otoscope. And number two, the cats rarely hold still for you to sit there for 5 minutes to, you know, let the mites move around. So just take a discharge, take a swab of the discharge, put it on a slide, look at it under the microscope. This is the easiest way to spot mites. Okay. These are the mite eggs in case anyone hasn't seen them. I think they're over. If we have a parasitologist here who can correct me on that, please do go ahead. Moving on to the oral cavity or an oral exam in cats. Okay, again, very, very important. We know that oral disease and gingivitis affects a large proportion of cats, and this oral exam is an important part of a general examination in a cat. Before you do that, again, I remind, and possibly this is the last reminder, though, do check that the cat is vaccinated. It takes 1 second for that cat to bite you, and then whoever is handling will have to take 5 vaccines. It's not fun. It's also important sometimes to hold those front legs down. That someone just has a, they give you a warning. The cat will let you know that it's not happy for you to do this. So choose your patients wisely. But if you can't, just pull up the commissure from the sides, like I mentioned, and do as well an exam as you can. Okay. So assess behavior. What you're looking for is teeth and how much tartar there is. You're looking at the gums for gingivitis. You're looking at the fauces. Okay, the fauces or faucitis is an inflammation of the commissure. So at the back of the mouth where the gums meet, where the mandible and maxillary gums meet, and I have photographs of this later. You're definitely looking at the palate, and you're looking at the pharynx as well to see if it's inflamed, and of course the tongue. Okay, so these are all the structures that you look at when you perform a very quick oral exam in a cat. So this is me doing one. And just a very quick look around the back, okay? And the cats will usually let you know when they are amenable to this or they're not. So these are the different things that you're looking at. You're looking at the palate, okay? There's something called eosinophilic granuloma complex, which we're going to talk about. We may not be talking about, but it is an allergic condition. I'll mention it here. It's an allergic condition, and they don't know the exact cause, but sometimes it can be linked to food as well. And what you get is plaques, and you can get plaques around the nasal planum. You can get on the skin, and or granulomas for that matter. And whenever you notice these, the first thing you should do is open the mouth and look at the palate as well. Okay, these are treatable. Steroids do help. This, for example, here, the rest of the mouth looks okay, but you can see almost a diphtheritic membrane on the tongue. This was a cat that had a very, very, very severe, I don't know if you can appreciate, but there's a slight jaundice tinge to that nose as well. It had a very, very severe pancreatitis. And this is a cat getting a dental examination, and you can appreciate the tartar on the teeth. And finally, this last photograph, I don't know if you see this very often in kittens. So open those kitten mouths. They're not eating. They've come in. They look like they've got cat flu. Open the mouth. Look for the ulcers on the tongue. There's a little ulcer right here on the tongue. Okay. So moving on. This is the oral exam. Just in case we see it very rarely, so I thought I'll take a photograph and show it to you. A healthy looking normal cat mouth. So you see there is no gingivitis. Nice healthy teeth. Okay, I presume this owner is brushing. A nice healthy tongue. They have these little hairy stiff papillae on their tongue, and so when a cat licks you, you can actually feel it because they're coarse, and this is normal. And this is the commissure I was talking at the back, which is called the fauces. Okay, fauces or faucitis it's called. Okay, so we want to do a normal thoracic auscultation. Abnormal heart sounds. Cats can have occult heart disease, but murmurs are possible, and you should always try and listen for them. You want to try and get a heart rate, and their heart rate tends to be much faster than in dogs. So what I usually, so it can go up to 200 beats per minute. What I do is I usually count for 6 seconds and I multiply by 10. I find that easier to do. Just a little tip. Gallop sounds are common with heart disease. Sometimes it's muffled heart sounds, which you can hear if there is either a hernia, a pneumothorax, something like that. So it's important to do a normal cardiac auscultation. Airway disease or parenchyma, it's important to remember that the cats have quite a small tidal volume. So for respiratory pathology to show up on your auscultation, on your thoracic auscultation, it has to be quite moderate to severe at least. So if the cats will often show other signs, for example, a resting respiratory rate. A respiratory rate in a cat should be between maximum 30 to 40, even if it's hot, per minute. If it is more than that at home when the cat is calm, the owner should flag this up to you. Sometimes for respiratory diseases, this and exercise intolerance is one of the most common signs. Yes, cats do cough, but they do not cough for hairballs, and they do not usually cough for cardiac diseases. So common causes of cough are respiratory in cat, not cardiac. And very often an owner will come and say, oh, he's coughing up hairballs, but they vomit out hairballs. Again, that's not always normal. You must look at why the cat is bringing out those hairballs, but they don't cough when they have hairballs. When we do an abdominal palpation, we want to know what is normal in the cat. Usually you will not be able to palpate a liver or a spleen in a normal cat. If you are palpating liver beyond the rib margins, this is abnormal. If you are palpating the spleen in a cat, this is an enlarged spleen. The right kidney is the cranial kidney. I mentioned liver margins. Of course, in an intact female, you want to look for the uterus to see if that is enlarged. If there are fetuses, cats get pregnant very easily. So if it is an unspayed female, it's important to palpate for the uterus. And of course, the bladder. If a cat is not urinating or has come in with a history of stranguria or dysuria. Superficial lymph nodes, as with all other species. And the reason that I've put this photograph of Dr. Bharat examining this kitten is because we usually leave the temperature taking to the last. It is not like in other species where we record all the vital signs first. We leave the temperature to the end because cats hate it. A little bit of lubrication helps. They're not always tolerant of it. And we can do it, restrain them a little, and then we let them go. So we usually leave it till the end, just before we administer a vaccine, for example. When you're looking at the perineum, this is also important, and we will be talking about this, but this is something that I want to flag up. We were doing a normal examination for a cat and went to take its temperature and found this bit of string sticking out. We all know about linear foreign bodies in cats. If there is something like this sticking out, the owner should be warned never to pull it out. B, if in this case, this came out very, very easily because it was actually only embedded in the feces already and in the distal colon and rectum. But if there is any resistance, it's important never ever to pull it out because you could land up lacerating the intestines and causing a peritonitis. At this point, you want to take radiographs and you want to then investigate for linear foreign body and then treat it accordingly. I think another thing that I would like to bring up is this is a Persian cat, obviously, and with the long-haired breeds, it is important to see that there's so much of fur covering this area that sometimes it's not easy to see your sex organs or your gonads. You want to look at the inguinal fat pad and palpate for it. So very often after you spay a cat and you've clipped the fur from the abdomen, ventral abdomen, the owner will come back and say there's a swelling there. And it's not a swelling, it's just their inguinal fat pad. They store fat over there and they continue to store fat there as they get older. And sometimes it becomes a little pendulous. Mammary glands are important. Cats suffer from something called feline mammary hyperplasia. I've actually borrowed this photograph because I didn't have one with me. And this is something that you can see. It's a fibroadenomatous hyperplasia of the mammary glands. It is not a mastitis. And it basically can happen in any unspayed female. It can be pregnant or non-pregnant. They've used agilpristone and cabergoline to medically treat it. But in addition to treating any secondary infection, the spaying of the cat or the ovariohysterectomy is actually the only final resolution to this sort of problem. Okay, males can get it if they have been given hormonal medications for some reason. So when you look at the perineum, which is the region around the anus, you're sexing them. You're looking to see if both the testicles are there or not, to see whether it is a cryptorchid, unilateral or bilateral. When we're talking about sexing in cats, we want to see these are, for example, adult cats, and so this looks like a neutered cat to me. I can even see the incisions, but this is a male cat, and you can see the scrotum. That's why it's been the hair has been removed. You can see the scrotum, which contains the testicles. This is the prepuce at the bottom, which has the penis inside. Okay, and this is your anus or your anal ring. So it is a circular organ which is a little distant from the anus. Females, on the other hand, it's almost T-shaped. It's a linear organ. Okay, it's a linear organ. They do not have pronounced vulvar folds as dogs do. And it forms an almost T shape along with the rectum, or the anus rather. You want to look at skin tenting for dehydration. So in cats, you can't just do that. Sometimes you have to lift up the skin fold and turn it to 180 degrees and then leave it and you can see it. And a flea comb is a very important part. I don't know if you are regularly doing this, but you need to have a flea comb and you need to have wet tissue paper. And you just comb the cat. You may not see any fleas. They say if you see one flea, there's another 100 fleas on the cat. So it's important to check for them. So you comb the coat and you just rub it on the wet tissue. And if you see blood spots which are disintegrating, these are flea eggs. And therefore, this cat needs to be treated for ectoparasites. Just a quick look at vital parameters in the cat. Body temperature is 38 to 39 degrees Celsius. So up to 102.2, 102.5 is normal for a cat. Okay. Heart rate 120 to 180 beats per minute. If you excuse me for a second. Come. Sorry, that was my dog trying to interrupt us. Yeah, so heart rate up to 180 beats per minute is normal. Anything above 200 should raise a red flag to try and see what is happening. Respiratory rate 24 to 36 breaths per minute in the clinic, 16 to 30 at home. Sometimes when it's hot, I think up to 36, 40 is okay. Body condition score 4/9 to 5/9, capillary refill time, and systolic BP up to 150 millimeters of Hg. We are going to talk a little bit in basic techniques about how to take blood pressure. Behavior is an important component of your general exam, and it should not be left out. At the very end, you must discuss a little bit about behavior. Periuria, for example, inappropriate littering habits. This is important, and we've really discussed a lot about FIC and stress and lower urinary tract disease. Vocalizing at night can sometimes be the first sign of hypertension, for example. Restlessness and irritability, unkempt hair coat, hypothyroidism fits together. There's something called cognitive dysfunction, which we know in older cats, they'll wander around aimlessly, they will be disoriented, they will vocalize, they lose sense of day and night. A lot of this can be harmless cognitive dysfunction. Pain is difficult to recognize. What are we looking for? We're looking for subtle changes in mobility, in jumping around, in choosing the spots to rest. Suddenly, instead of sleeping on the bed, the cat wants to sleep in a corner on the floor. Okay. Suddenly, every time it's lying down, it keeps moving from side to side. It's uncomfortable. These are all, there's a slight shivering in one leg. These are all signs of pain. Polyphagia and polydipsia, of course, we know polyphagia, for example, can be endocrinal or, hepatobiliary, and must be flagged up. In some cases, a general exam will point us towards a focused exam. We are not going to go into these in detail, except for the ophthalmic exam. So you can do an ophthalmic exam, you can do an orthopedic exam, you can do a dermatological exam, and of course, a neurological exam. This is me doing placing reactions in a cat who had seizures and ataxia. And I'm doing it on the table, and I'm waiting for her to sort of feel the side of the table and step up. And when we do an ophthalmic exam, the reason I put this photograph in is because you want to actually use, you can actually do a fundic exam without dilating the pupil. You don't need to put in your topicamide and make the cat sit in there. If you are starting, if you have an ophthalmoscope, I would recommend you look at every cat's fundus so that you start picking up the abnormalities, especially in the senior cats. It's important to know what is normal to then pick up what is abnormal. So if you use the light, your ophthalmoscope on a slightly lower intensity, then the cat does not constrict its pupil completely, and you can have an adequate look at the fundus. So I've borrowed these wonderful images from Clinician's Brief because I think I must talk a little bit about a fundic exam. The cats have, as like dogs, they have this tapetum lucidum, which is the reflective layer, and it's very interesting. So apparently in cats, it is a little more reflective because they are nocturnal. So it's the layer behind the retina, and what it does is it reflects a little more light that comes onto it, back onto the retina to improve visibility in low light. And we know that cats are most active in dusk and dawn. So this is a evolutionary adaptation. One part of the tapetum lucidum is also sort of reflective, and it is normal. It's this white arrow here, okay? And this, it's called a non-tapetum, and this is absolutely normal. In some cats, it is non-pigmented, and like Siamese, for example, I think, and that's also normal. So it's important not to think that that is bleeding or hemorrhage happening there. For example, this is hemorrhage. This is not hemorrhage. These little blue arrows they've pointed out are just from the camera flash, and they are not artifacts. So what are we looking at? We are looking at the tapetal layer. We are looking at the optic disc, and we are looking at the cilioretinal vessels, okay? And what abnormalities, we're going to do a quick look. So when I look at the cats, I am looking through my ophthalmoscope, and I just move from side to side, and try and get a good look as much as I can of as much of the fundus as I can. If I think there's an abnormality, I always have a chance to do a more detailed examination using a slight sedative to keep the cat calm in a dark room with some pupil dilatation. I can do all that. When we see hypertension in cats, one of the first signs we see is hemorrhage around the blood vessels. So the blood vessels, they can be certain spots, or it can be like this, which is quite a significant hemorrhage. And the other thing that we want to look for is detachment of the retina. So you can see this non-shiny gray area where there is a complete detachment of the retina. And very common reasons for both hemorrhage and detachment are hypertension in cats. Okay.